This is County Executive Warren Evans, and this is Inside Wayne County.
Hello and welcome to Inside Wayne County. I'm your host, Lloyd Jackson, and this show is designed to give you important information and also keep you informed about what's going on inside Wayne County government. Today I want to introduce you to a new department which was created by the Consolidation of Children and Family Services, Health and Human Services, and Senior and Veteran Services. The new department is called Health, Veterans, and Community Wellness. And while work continues behind the scenes to get this department up and running, I'd like to introduce you to the director of the department, Dr. Mouhanad Hamammi. Dr. Hamammi, thanks for spending a little time with us on Inside Wayne County.
Thank you, Lloyd. Good to be here.
You know, when we start, we always like to introduce the guests to the residents of Wayne County. So let's find out who Dr. Hamammi is, or as we call him, Dr. H.
Sure.
Dr. Hamammi, talk about where you grew up, your education, and your work experience.
Absolutely. Well, I was born in Aleppo, Syria. Of course, everybody knows where Syria is now.
Yes, they do.
And came to the States back in '88, and I did my post-grad. I graduated from medical school overseas, and then I did my post-grad in pediatrics at the University of Tennessee in Memphis.
Okay.
Then moved to Detroit area because I got an appointment at Wayne State University School of Medicine, where I was engaged in pediatric research at the Detroit Medical Center for almost about 15 years. And then after that, I got a little bit into the organized medicine field, and I managed a nonprofit organization, the National Arab American Medical Association. And right after that, in 2009, I was appointed to my current position as the health officer for Wayne County. And since then, it's been a great ride, as they say, and here we are.
As public health officer, what are your duties?
Well, as a public health officer, then we are basically the authority that ensures that the communities in Wayne County and residents in Wayne County are safe from a health-wise perspective, but also from a place-wise. So the built environment, the environmental health is a major component of what public health do, and as well as food inspection, for example, beaches and swimming pools and all that falls under the health department. And of course, with the new department, then that vision has evolved to include the concept of wellness.
Now let's talk about the new Department of Health, Veterans, and Community Wellness. This is a concept that you kind of had in your desk a little while, and nothing was done about it. Why was that?
Well, there's the trend now. We are shifting from the traditional concept of health services.
Okay.
And this is not something new. It is something that everyone is looking into. But of course, change requires a lot of courage, a lot of will, and of course, it is not free of challenges. To shift even the way we think about how a health service needs to be delivered, and to look at it from an upstream approach is revolutionary to start with. Because for an example, if we look at what is connected to health immediately, then the first thing that would come to your mind is that, okay, I need to see a doctor to be healthy. But with the new approach, then you need to look into what really constitutes health and wellness, and what is the environment that is conducive for you to not only be healthy, but also to practice wellness as a state of mind. So everything that involves the community you live in, the job you have, the type of education you receive, and these are what we call the social determinants of health.
Zip code, all of that is in
Absolutely. My slogan is, it is not your genetic code, it's your zip code that makes you healthy or not. So with this new concept, then we are looking at a holistic approach to how communities in Wayne County can be a medium to practice health, and how can we ensure that all the right things are in place for people to be healthy, not only as individuals, but also as whole communities.
How did that name come together? It's Health, Veterans, and Community Wellness. How did that name come together for this new department?
Well, of course, it is pieces of all the departments that have been joined together, but we also wanted to make sure that we are telling the public who we are. So many times, if you need something from a government entity or from a local government, let's say you go for a restaurant permit, then chances are you're only there for that, what we call the primary need. So you walk in, you apply for the restaurant permit, and you get your license, and then you leave. But what you might not know, that you can also apply for, if you have a young child, you can apply for WIC services. Or if you need a flu shot, you can do it as well. Or if you have a veteran in your family, or a senior citizen, or anything that is related to some services that we are providing at the county, then this is where you can also apply for them. So we wanted to make sure that the name is inclusive of who we are and also the services that we represent. But what is I'm mostly excited about is the community wellness component of it. And this is where community development is going to be a great player and a great addition to this department.
Because community development is under the umbrella of the new department.
That is correct. That is correct. And as you know, and I think you have talked about it in a previous show,
I did.
Community development looks at neighborhoods. It looks at stabilizing neighborhoods, blight removal. It looks at public spaces, looks at parks and bike routes and bike lanes and all that. And this is where we talk about a revolutionary approach to health. Because in the past, this was urban planning, and it wasn't something that a health official is involved in. In fact, several months ago, I was invited to speak at the American Institute of Architects, and it was thrilling that now we're adding science to the art, and it is a marriage of the minds.
In the new Department of Health, Veterans, and Community Wellness, there are divisions under that. Can we talk a little bit about the different divisions? I believe it's 6 divisions, starting with the medical examiner.
That is correct.
Which basically is the medical examiner, you know. But there are other divisions, the Veterans Division. Talk about a little bit about that.
Absolutely. As you mentioned, Lloyd, we have 6 divisions. So we have the medical examiner, and that is where most of our forensic medical practices happen in the county. The Veterans Division is a new division, well, not really new, but it is now new under this new department. And it will continue to look at services that we provide to our honorably discharged veterans, such as the Soldiers Relief Fund, the emergency financial assistance, as well as the burial for our veterans. These are Wayne County residents that have served this country, and they have paid their dues to our society, and it is our honor to make sure that their needs are being met. But we want now, under this new umbrella, to take it a step further and look at any other needs that we haven't tapped into before. So for example, those veterans, although they receive their health care through the VA hospital, then their families might need further assistance, or they might have children that might qualify to enroll in Head Start programs, or they might have a senior citizen in the family that can benefit from our Meals on Wheels program. So this is, again, the holistic approach of making sure that all those services at the new department are available for anyone who walks through the door.
And there's a seniors division as well, and access to care.
We have access to care, which is our under the ACA, many of the residents of Wayne County will qualify for one type of insurance or another. But there are still those that do not fit within the too poor or too rich to afford it. So the access to care is still going to look at those needs for health insurance and health coverage. So for example, the immigrants do not qualify, those that haven't met the 5-year requirement yet. They do not qualify for the expansion of Medicaid, or they might not qualify for, or the rates for the insurance exchange are going to be so high. So access to care is our 3rd division. Then we have the Division of Clinical Services, and this is where any type of clinical service that we provide at the county is going to be under this division. So as you know, we provide clinical services at jail health. We provide it at a juvenile detention facility. We already have one federally qualified health center in the city of Hamtramck. We're opening our next in the city of Wayne at the health department. And our public health clinics. So all these are going to be under the Division of Clinical Services.
And you have wellness services.
And then we have wellness services that truly is the evolution of what the traditional public health model is as a local health department. But also we will combine to it a component of social wellness through adding the Community Development Division as well as our collaboration with the Michigan State University Extension. We and the Michigan State University Extension have so many overlapping and complementary programs, and this synergy is going to benefit the residents of Wayne County in so many ways. For example, the Master Gardening Program, or the Chronic Disease Management Program, or something as simple as health educators. We just met this morning with the director of the MSU Extension in Wayne County, and it was amazing how much we can do together. One thing that we are looking into now, they have a health educator that is involved in the management of diabetes. And if we can tap into such a tool and start looking at where we see patients through our 2 clinics, our federally qualified health centers, then can you imagine the value of someone who is diagnosed as diabetic by immediately connecting that person with a health educator that are going to walk them through everything they need to know of how to manage it from a lifestyle behavior.
Juvenile and health and juvenile and youth services as well.
That would
as
be
part
our
of this.
That would be our 6th division, which is juvenile and youth services, and this is where our young and youth are going to be under. So it will be composed of the Head Start program, as well as the juvenile youth services, which are the community-based and school-based residential programs for young offenders.
So Dr. H, if I hear you correctly, it seems like to me we'll have these touch points, but they all are connected. So basically you could go to any one of these areas and get help in the rest of the areas. It's kind of like the no wrong door approach.
It is absolutely no wrong door. Any door that you're going to walk through is going to meet your needs first, and then if you have other needs, then that door is going to open to other doors, and that referral should happen in real time if these are services that we provide at the county. And if not, then we will make sure that you are connected to our partners, other community organizations that will help you. Now, in the future, we hope to expand this and use some innovative tools and social media as well as technology. My vision is that at one point you can walk to a kiosk at a train station or at a library or whatever, or a mall, absolutely, even at the airport. And you can access all those services by self-service.
You know, when you talk about putting all this together, you know, you're really cutting down on a person who has to go to 5 or 6 different places. And that was one of the things that you were really trying to cut down on, as far as a person having to go to one place for their primary need, and then maybe they need help on other things, and now they have to pack up, get back in the car, go somewhere else, park again. You cut all that out when you have that no wrong door policy.
Absolutely. And I'm sure many of our county residents can tell stories about the hoops they had to jump through just to get their primary need met. So this is a very ambitious plan, but we're very confident with the talent and the dedication of our staff. And it will require a little bit of a change of culture, where both our staff and also our county residents are going to go the extra mile to make sure that they are aware of what they can access through this new department, and also our staff are aware of what they can offer through this department. We have been operating within our boundaries. I hate the word silo, but I would call it within our main restrictive boundaries. But now with this model, then there is no excuse for us not to be able to communicate across those borders and make sure that we're operating as a one unit. And again, the key, as you mentioned, is to eliminate the need for anyone to go through another door. So that first door is the right door, and it will lead you to anything that you need.
This consolidation also saves the county money, the general fund, about $3 million annually. That's great because we're in a financial situation right now. But this is really, according to the CEO, Warren Evans, this is really also about quality of life.
Absolutely, absolutely. And as you mentioned, this idea is not something that just came up. This idea was something that we thought about in the past. And of course, there were restrictions both from a structural restrictions as well as financial restrictions. But I think the most thing that was lacking was the will on behalf of the leadership. And then we're very proud that this happened with the new administration and with Mr. Evans' blessing. And I believe that the key is not only to cut down cost, which is a major thing, but the key is to deliver the best services in the most efficient way. and the ultimate goal is to serve our county residents.
We touched a little bit on community development, and as you said in the previous show, I spoke with Ann Lean, and a lot of people would say, okay, community development and health and veterans and wellness, how does that play a part in that, and how does that help in this whole new department? Connect the dots for the residents out there.
Oh, absolutely. And I always, I'm always asked, why would refurbishing a public service building, for example, make you healthier? Well, it's very simple. So let's look at, let's not name any neighborhoods, but
okay.
Let's take a neighborhood where there is a lot of blight.
Okay.
Then chances are, if you live there, not only mentally you don't feel good, there is a term that I use, is called biophilia. Biophilia is love of nature. And this is why when you decide to take a vacation, you go somewhere nice. You
Sunshine,
either go, yes,
warm,
either a beach
water,
or a forest or whatever, because it is our inherent tendency to enjoy beauty of our surroundings. So you can imagine the anti-biophilic neighborhood is a neighborhood that is a blighted neighborhood. Not only it is mentally and spiritually not conducive for you to be healthy or well, but also it restricts what you can do or what your children will do. You're probably concerned that your children are living in a blighted area where they are not going to go outside and play. Maybe it is not safe. Maybe there's crime rate or whatever. So that also limits the physical activity for those children. And children that are not active are more prone to be obese. And if they're obese, then they will have more health problems. So everything leads to health, and everything is connected. The same thing applies to, so when you come to a community and you see, for example, there are no bike routes, or you can, the pavement would not allow you to walk, not only because it's a badly constructed pavement, but there are no trees, there is no shade. If it's a hot day like today, then chances are you will not go and walk. You probably will use your car, if you have a car,
That's right.
or you stay home. So again, this is all how the place is so tightly connected to you practicing health. So again, it is no longer what we live in Southeast Michigan, and specifically in Wayne County. We have access to 5 of the best major healthcare systems in the state, if not in the nation. But yet, when it comes to county health rankings, we rank at the bottom. So it is not the access to care, maybe the quality to care a little bit, but it is more the environment we live in and the place we live in.
Also part of this new department too, we have some employees from different buildings that are going to be coming into the Guardian building, which number one boosts the number of people in the Guardian building, but it also allows us to deal with some of the inventory of buildings that are owned by Wayne that are maybe underutilized.
That is correct. That is correct. Well, I do believe in a centralized operation. I do believe in teamwork. I do believe that it is not one man's show. It is collective leadership, and it's collective effort for us to make sure that we are serving the residents of Wayne County in our best capacity. So it makes perfect sense for people who work together to be together, and it doesn't make sense that we're fragmented into all those different buildings. As well as we had the issue with the capacity or the occupancy rate at the Guardian building. So there's tons of space. So it made perfect sense to consolidate all those operations together and to have the best use of the physical space. Now that gives us an opportunity to look at buildings that we're vacating. For example, there are buildings that are at prime location, or there are buildings that have some value for other investors. And this is where we can also alleviate some of the financial burden on the county from one, maintenance of those buildings, and then also getting a reward on the investment as well.
Before I let you go, I got to ask you about the Fun Fest coming up on August 20th out in Wayne at Van Born at the Public Health Department. This Fun Fest is great for kids on the way back to school. A lot of things going on there, screenings, immunizations, dental screenings, blood pressure, the works.
Absolutely. I'm glad you reminded me about that. Our Fun Fest is, as you mentioned, it's our back to school festival. It's a health fair that usually we do it around this time. It's going to be on August 20th from 10 a.m. till 3 in the afternoon. It's going to be on the front lawn of our health department on the corner of Vinoy and Van Born in the city of Wayne. And although this is our recurrent Fun Fest, but this is the first one that's going to be under the new department.
Yes.
So we're launching it with a bang. Ideally, we do it for those children that are going back to school to get their physical, to get updated on their vaccines and their childhood immunizations and all that. So our clinic is going to be open, and it's going to serve those that need to be up to date on their shots. But also we have about 45 community organizations and vendors and educational institutions that are participating. There'll be a lot of free giveaways. There's a raffle. We give safety bike helmets. We give bicycles.
The CEO will be there for that.
Yep, Mr. Evans is going to be there. And we invite also the fire department. They do some education for the children. We have exercise. We have free food. We have hot dogs. We have water and soft drinks. And we try to be healthy. So we also
Yeah.
would be encouraging people to eat right and exercise. So it's going to be fun. And I encourage all our residents to make sure that they stop by.
Absolutely, and for more information, they can look on our screen and they can get the telephone number where they can call to get more information. Dr. Mouhanad, thank you so much for being here on Inside Wayne County. Appreciate you being my guest today.
Thank you, Lloyd.
Stay tuned for upcoming shows as I take you inside Wayne County departments and introduce you to the people in charge and the many services they provide. It's all with the goal of keeping you up to date on everything going on inside Wayne County. I'm Lloyd Jackson. See you next time.